Good afternoon. We are Rosario Forno, Valentina Ugarte, Maria Esperanza Jara, and Catalina Papagalo. And in this work, we will talk about pyelonephritis tissue, what are its main characteristics, symptoms, treatment, and prognosis.
Acute pyelonephritis is defined as an infection of the upper urinary tract, which affects the pelvis and renal pain. Its importance is due to the serious complications that it can cause, although most of the time an early diagnosis and early treatment make it possible for the patient to evolve favorably. Some of the symptoms that the patient may present are fever over 38.5 degrees Celsius and chills, pain in the lumbar region, although sometimes it can radiate to other areas of the abdomen, nausea and vomiting, decreased appetite, headache.
The treatment of pyelonephritis is with antibiotics which last between 14 to 21 days. It is important to identify the causes and microorganisms before starting treatment with antibiotics. It is important to note, however, that the choice of antibiotic is usually made immediately, as complications can be much more serious, heavy bleeding in the urine, cancer, cirrhosis, and sepsis. If the fever persists for more than 3 days at the start of treatment, it means that the body has developed resistance to the antibiotic or that there have been any complication maintained over, so you never to see a doctor to change the medicine.
The prognosis of acute pyelonephritis is usually good most of the time, and patients evolve quite well if they complete with the treatment. The main complications are the existence of permanent renal damage, the development of a renal abscess, of the appearance of sepsis, which are potential cause of death.
Pictures. In this picture, you can see the inflammations and the infection of the kidneys for inside and outside. Conclusion. We can conclude that pyelonephritis is a very risky infectious issue, involves general symptoms, and the consequences, if it's not treated, can cause chronic damage to the kidneys. This is why it is important that the diagnostic be detected in time, to find the exact bacteria that is causing this infection in order to be able to intervene with a treatment as soon as possible and to heal and patients promptly.